Our top story, a gain for community access to the coronavirus vaccine at the Reggie Lewis Center in Roxbury. Additional doses provided by the state are being coupled with outreach by community groups, including the Black Boston COVID-19 Coalition. Those efforts were highlighted Saturday in a visit by elected officials.
The federal government has failed to meet the scale and scope of this crisis. And so what in this moment, I want to affirm and acknowledge is the collective care and the mutual aid that community has stepped up and has stood in the gap when government has failed. I'm here today because this is emblematic of the best kind of partnership, one that is community driven and government endorsed. This work should always be led by community.
We cannot allow this treatment, this vaccine, to be held back from those who need it, and that is people with a disproportionate impact. It's all of us who have experienced COVID, but we know we've got to make sure that those who've been hardest hit, often elderly, poor people of color, people with multiple illnesses, we have to make sure that they have not only equitable access, but confidence in the vaccine.
At the end of the day, we need people to trust our doctors, trust science, and yes, the best way to do that is to acknowledge our horrible history in both of those industries and how they have hurt people of color. So we need to be honest about what has happened. At the same time, we need to tell people it's time to trust again and get in here and get vaccinated.
There is a significant lack of trust within communities of color in terms of their healthcare system, right? It's not necessarily an issue of vaccine hesitancy. It is a mistrust in the American healthcare system that is rooted from a long history of experimentation, be it the Tuskegee experiment, whether it's the sterilization of Puerto Rican women, and that happens today in America as well. And so as we go out there seeking to vaccinate Black and brown communities, we need to understand this, we need to attack it, and we need to be very upfront with the people who have the resources and the money to vaccinate these communities.